So there's daratumumab, or Daralex, or Dara, and Daralex is the trade name. It had some incredible responses when Dara is combined with Revlimid and dexamethasone. And these are the response rates. So what we're used to seeing in relapsed myelomas, we're used to seeing 30% response rates, maybe 20% response rates. That's the usual response rates that we see with relapsed myeloma. When this trial was done and we had for the first part of the trial, it had a 90% response rate. That kind of blew everyone's minds. The fact that when they did the expansion part of the trial, that there was an 88% response rate was incredible. And these weren't little tiny responses. These were very good responses where the protein was only detected by a very sensitive measure to find myeloma, or people went into complete responses. And so this was a very effective therapy and kind of blew everyone's minds about how well it worked. The biggest side effect is the infusion reaction. So these are foreign proteins. Again, these aren't proteins made by your body. So when they're infused into your body reacts to it the first time it sees it. And so people can get hives, they can get shortness of breath, they can get fevers. The one sort of cool, and it's always on the first, if it happens on the first infusion. Nobody has ever not finished daratumumab in clinical trials because of reactions. The second one is much better. Singulair is an anti-allergy asthma medication. If you give Singulair before you give the daratumumab, the reactions go away. The overall response rate was 88%. A lot of very good, 53%, better than very good responses. But the interesting thing is that this isn't chemotherapy, and so it uses your own immune system to fight the myeloma, and everyone's immune systems are different. I've seen daratumumab work in 2 weeks. I've seen it take 3 months for it to work. And it's because it uses your own immune system, and your own immune system may work at its own pace. The time to first response can be delayed. However, that when you continue daratumumab, the longer you're on it, the responses just continue to go down as your immune system continues to clear the drug.